Welcome, everyone, and thank you for joining me today. I'm excited to introduce our topic, aerosol drug therapy, principles and practices. In this presentation, we'll explore the fundamentals of aerosol generation, various delivery systems, how deposition occurs in the respiratory tract, and the clinical applications of these therapies. We'll cover all these key areas to give you a comprehensive understanding. Let's get started. Welcome to Chapter 40, where we delve into aerosol drug therapy, principles and practices. On this slide, we're focusing on the core concept of aerosol drug therapy itself. Essentially, this involves delivering medication directly to the lungs through aerosols, which are tiny particles suspended in air or oxygen. This method is widely used because it allows for rapid absorption and targeted treatment, making it highly effective for respiratory conditions. As we explore this chapter, keep in mind that understanding the principles behind aerosol delivery helps us optimize therapy, ensuring patients receive the most benefit with minimal side effects. Throughout this presentation, we'll look at the key techniques, devices, and considerations that influence successful aerosol drug administration, connecting everything back to improving patient outcomes. Let's talk about aerosol drug therapy, focusing on the principles and practices involved. On this slide, we see that medications can be delivered as liquids or dry powders during a single breath, which highlights the importance of proper inhalation techniques. Inhalers are common devices that use compressed gas or electricity to propel the medication into the lungs. Nebulizers, on the other hand, have been used for a long time and convert liquid medication into a fine mist that can be inhaled over a period of time. Historically, atomizers were among the earliest devices used to generate aerosols, especially for respiratory treatments. The core idea behind medical aerosols is that we generate tiny particles, small enough to suspend in a gas, so they can reach the deeper parts of the lungs. An aerosol, in essence, is just a suspension of solid or liquid particles within a gas, which makes it an effective way to deliver medication directly to the respiratory system. Understanding these basics helps us appreciate how various devices work to optimize drug delivery and improve patient outcomes. Let's talk about the administration of drugs by aerosol. One of the key benefits here is that it allows us to achieve higher local drug concentrations directly in the lungs, which is often what we need for effective treatment. At the same time, systemic levels tend to be lower compared to other methods, helping us reduce potential side effects. The main advantage of aerosol drug administration is its targeted delivery. Our goal is to deliver the right amount of medication precisely where it's needed, whether that's in the nose, the throat, the large airways, the small airways, or even the alveoli. This targeted approach not only improves the effectiveness of the therapy, but also minimizes unnecessary exposure elsewhere in the body. So, in essence, aerosol therapy is all about delivering a therapeutic dose efficiently and accurately to the specific site of action, making it a very valuable tool in respiratory care. Let's take a closer look at aerosol output in drug delivery. When we talk about the emitted dose, we're referring to the amount of medication that actually leaves the mouthpiece of a nebulizer or inhaler as an aerosol. This is a crucial point because it directly impacts how much drug reaches the patient's lungs. It's important to note that the amount of aerosol output can vary significantly among different devices. Some nebulizers and inhalers deliver more consistent doses, while others may produce less or more depending on their design and usage. Now, to understand aerosol output more clearly, we define it as the mass of fluid or medication produced by an aerosol generator per actuation or over a specific period of time. This helps us compare device performance and optimize delivery to ensure effective treatment. Overall, understanding these concepts helps us improve drug delivery efficiency and patient outcomes. Let's take a closer look at what happens during aerosol drug therapy. First, up to 5% of the inhaled drug can actually be exhaled without reaching the lungs. This means that not all of the medication we breathe in stays in the respiratory system. It's important to understand that not all aerosol particles delivered to the lungs are deposited or retained there. Some particles are exhaled again, and others may not reach the lungs at all. This brings us to the concept of retention of aerosol particles. Only a certain proportion of the inhaled dose actually gets deposited in the lungs, which is what we refer to as the respirable dose. And before the drug even reaches the lungs, only a portion of the emitted dose is actually inhaled by the patient. So, when we think about the amount of medication that can be effective, we have to consider all these steps, from emission, inhalation, to deposition. Understanding these principles helps us optimize inhaler techniques and device choices to ensure patients get the most benefit from their therapy. Now, let's talk about the third mechanism of aerosol deposition, which involves particles moving randomly due to molecular motion. This process is known as Brownian diffusion. What happens here is that tiny particles, because of their small size, move in a random, zigzag pattern and eventually deposit on surfaces simply because of this motion. It's a key way that very small particles settle out of the air. Another important mechanism is gravimetric sedimentation. This occurs when particles settle downward due to gravity, especially when their velocity decreases over time. Think of it as particles gradually sinking and settling onto the surfaces below, which is especially relevant for larger particles. Finally, we have inertial impaction. This mechanism happens when particles collide with surfaces because of their inertia. As the airflow changes direction or speed, particles tend to continue in their path due to inertia, causing them to impact surfaces like the airway walls. Together, these mechanisms, Brownian diffusion, gravimetric sedimentation, and inertial impaction, are essential for understanding how aerosol drugs deposit in the respiratory system. Each plays a role depending on particle size, airflow, and the environment within the airways. Now, let's take a closer look at deposition, specifically focusing on inertial impaction, which is a key process in how aerosols deposit in the respiratory system. Inertial impaction occurs because the greater the mass and velocity of a moving particle, the more inertia it has. This means the particle tends to continue along its original path rather than following the airflow when it changes direction. This concept is especially important for larger particles, typically those greater than 5 micrometers, because their inertia makes them more likely to impact and deposit onto surfaces within the airways. Essentially, when aerosols in motion collide with a surface, like the lining of the respiratory tract, they can stick there, which is how deposition occurs for these larger particles. So, to sum up, inertial impaction is the primary mechanism for depositing larger aerosol particles. The key takeaway is that the particle's mass and velocity directly influence where and how effectively these particles deposit in the respiratory system, playing a crucial role in aerosol drug therapy. Let's talk about deposition and how it affects aerosol drug therapy. When you hold your breath after inhaling an aerosol, it actually increases sedimentation, which helps distribute the medication more effectively throughout the lungs. This breath holding plays a crucial role because it allows particles to settle and reach deeper into the lung tissues. In fact, it's the primary mechanism for depositing particles that are between 1 to 5 micrometers during normal breathing. Now, an important point to remember is that the heavier the particle, the faster it will settle out of the suspension. This is because gravity has a greater effect on larger, more massive particles. This process, called sedimentation, occurs when particles settle out of the air suspension and deposit onto the lung surfaces due to gravity. Understanding these mechanisms is key to optimizing aerosol therapy, ensuring that the medication reaches the intended areas in the lungs efficiently. Let's take a closer look at some of the particles involved in aerosol drug therapy. Particles that are between 0.1 and 0.5 micrometers are actually quite stable. In fact, most of these particles tend to stay suspended in the air for a long time. This stability means they can remain in the suspension without quickly settling out. Additionally, these tiny particles can be cleared from the respiratory system along with the exhaled gas. So, during exhalation, some of these particles are naturally expelled from the lungs, which is an important aspect of how the body handles them. Now, focusing on how small particles behave inside the lungs, especially those less than 3 micrometers, they tend to deposit deep within the lung tissues. The primary mechanism behind this is called Brownian diffusion. This process involves the random movement of these tiny particles, which increases the likelihood of them hitting and sticking to the alveolar surfaces. This deep deposition mainly occurs when aerosol particles reach the alveoli, the tiny air sacs where gas exchange happens. Understanding this behavior is crucial because it helps us optimize drug delivery, ensuring that medication reaches the deep parts of the lung where it can be most effective. So, in summary, the stability of small particles, their clearance with exhaled gas, and the process of Brownian diffusion are all key to understanding how aerosolized drugs deposit within the lungs. These principles are fundamental to designing effective aerosol therapies. Now, let's talk about medicated aerosols and a key concept called the mass median aerodynamic diameter, or MMAD for short. This is essentially a measure of central tendency that helps us understand the particle size distribution within an aerosol. It tells us the particle diameter in micrometers, or microns, which is a very small unit of measurement. The MMAD is important because it influences where the particles will deposit in the respiratory tract, impacting the effectiveness of the therapy. When we consider aerosol particle size, it's not just about the MMAD alone. Several factors come into play. For example, the substance being nebulized can affect particle size. Some substances tend to produce smaller particles, while others create larger ones. The type of aerosol generator used also makes a difference, as different devices are designed to produce specific particle sizes. And finally, environmental conditions, such as humidity and temperature, surrounding the particles can also influence their size and behavior. Understanding these factors is crucial because they directly impact how effectively the medication reaches the targeted areas of the lungs. So, in summary, the particle size in medicated aerosols is influenced by the substance, the device, and the environment, all of which we need to consider to optimize aerosol therapy. Let's take a closer look at some key points about aerosol drug therapy. First, it's important to understand that the effectiveness of this therapy depends heavily on the correct delivery method. Proper technique can make a significant difference in how well the medication reaches the lungs. Next, the choice of device is crucial. Different devices, like nebulizers or metered dose inhalers, have unique advantages and considerations. Selecting the appropriate device for each patient ensures optimal drug delivery and therapeutic outcomes. Another important aspect is patient education. Teaching patients how to use their inhalers correctly can greatly improve treatment efficacy. Proper inhalation technique minimizes medication wastage and maximizes drug deposition in the lungs. Finally, consistent monitoring and follow-up are essential. This helps assess whether the therapy is working effectively and allows us to make any necessary adjustments. All these points tie back to our overall goal, providing safe, effective, and patient-centered aerosol drug therapy. By focusing on proper technique, device selection, patient education, and follow-up, we can ensure the best possible outcomes for our patients. Let's talk about the aging of aerosol drug therapy and how its composition plays a crucial role in this process. The specific makeup of an aerosol directly influences how it changes over time, affecting its efficacy and safety. Ambient conditions are also significant. Things like humidity, temperature, and air quality can accelerate or slow down the aging process. So, when aerosols are in suspension, the environment around them matters a lot. Time in suspension is another key factor. The longer aerosols stay in the air, the more they can undergo changes, like particle growth or breakdown, that impact their behavior and delivery. Particle size dynamics are particularly interesting. Aerosol particles can change size because of evaporation or water absorption through hygroscopic growth, which can alter how deeply they penetrate the lungs. Ultimately, how an aerosol ages depends on its composition, the initial size of its particles, and the various factors influencing it. To sum up, aging is essentially the process by which an aerosol suspension changes over time, and understanding this process helps us optimize drug delivery and treatment outcomes. Let's talk about how breath holding influences particle deposition in the respiratory tract. When a patient holds their breath after inhaling, it can actually change where those particles settle. This is why breath holding is an important technique to maximize medication delivery. Next, consider the inhaled volume, the amount of air a person takes in with each breath. This volume impacts where particles deposit, since larger inhaled volumes tend to allow particles to reach deeper into the lungs. Similarly, respiratory rate, the number of breaths per minute, also plays a role. A faster or slower rate can alter the pattern of particle deposition, affecting how effectively the medication reaches the target areas. Flow pattern is another key factor. Whether the airflow is laminar or turbulent influences where particles settle within the respiratory system. Understanding this helps us optimize inhaler design and technique. The strength and speed of inspiratory flow are also crucial. How a patient inhales, whether quickly or slowly, can determine where particles of any specific size are deposited, affecting the overall effectiveness of therapy. And it's important to remember, particle size isn't the only thing that matters. While size influences deposition, other factors like flow dynamics and inhalation technique also play significant roles. By understanding all these elements, we can better tailor aerosol therapy to each patient's needs. Let's take a look at some of the potential hazards associated with aerosol therapy. First, eye irritation can occur as a result of the treatment. This is something we need to be aware of, especially when administering aerosols near the face, to prevent discomfort or injury to the patient's eyes. Next, we have the systemic effects of bland aerosols. While these are generally considered safe, they can sometimes cause unintended effects throughout the body, so monitoring is important. Another key point is airway reactivity. Some patients may experience increased airway sensitivity or bronchospasm in response to aerosol therapy, which can complicate their condition. We also need to consider the risk of infection. Aerosol therapy can potentially introduce pathogens, posing a threat not only to the patient, but also to healthcare workers and bystanders. Proper infection control measures are essential here. Finally, the primary hazard we must always keep in mind is the possibility of adverse reactions to the medication itself. Sometimes, the medication can cause unexpected side effects or allergic reactions, so being vigilant is crucial. All these points highlight the importance of understanding and managing the risks involved with aerosol therapy to ensure safe and effective treatment. Let's talk about aerosol drug delivery systems. When it comes to aerosol drug therapy, the key is having a device that can deliver the medication effectively and efficiently. An ideal device should be able to quickly deliver enough of the drug to the specific site of action, ensuring the patient gets the maximum benefit. At the same time, it's important that the process minimizes waste, so we're not losing medication in the environment or the device itself. Cost is also a critical factor. Using a low-cost device makes the therapy more accessible and sustainable over time. Overall, the goal is to optimize the delivery process to make sure the medication reaches where it needs to go, efficiently and economically, which ties back to our broader focus on effective and practical aerosol therapy. Today, we're going to focus on pressurized metered dose inhalers, or PMDIs, which have a significant place in the history of aerosol drug therapy. These devices revolutionized how we deliver inhaled medications, making treatment more accessible and convenient for patients. The key points to remember are that PMDIs are portable, easy to use, and have been around for several decades, marking an important milestone in respiratory care. Their development represented a major step forward in providing precise, controlled doses of medication directly to the lungs. As we explore these devices, it's important to see how they fit into the overall principles of aerosol therapy, emphasizing effective drug delivery and patient compliance. Understanding their historical significance helps us appreciate how far we've come in improving respiratory treatments. Now, let's talk about pressurized metered dose inhalers, or MDIs for short. These inhalers contain a pressurized canister with the prescribed medication, which is mixed with a volatile propellant. This propellant helps deliver the medication efficiently. Additionally, there are surfactants and dispersing agents included to ensure the medication is evenly distributed. The key benefit here is that each time you use the inhaler, you get a uniform dose, which is essential for consistent therapeutic effects. MDIs are also known for their convenience. They are portable, compact, and easy to carry around, making them ideal for patients on the go. Plus, they provide the advantage of multi-dose use, so you don't need a new inhaler each time you need medication. In the United States, MDIs are actually the most commonly prescribed method of aerosol drug delivery. This widespread use highlights their effectiveness and the ease with which patients and healthcare providers can incorporate them into daily management of respiratory conditions. Overall, pressurized MDIs combine reliability, convenience, and efficiency, making them a cornerstone of aerosol therapy in respiratory care. Now let's take a closer look at how pressurized metered dose inhalers, or MDIs, work to deliver medication effectively. First, when you invert the canister, nozzle down, and place it into the actuator, the suspension inside fills the metering chamber. This step is crucial because it prepares the dose for delivery. Next, when you press down on the canister, it aligns a small hole in the metering valve with the metering chamber. This alignment allows the high-pressure propellant vapor to push the medication out. Because of the high vapor pressure, the metered dose is expelled through this hole and out through the actuator nozzle efficiently. It's interesting to note that the entire process of aerosol production is very quick, taking approximately 20 milliseconds. This rapid action ensures that patients receive a precise and consistent dose each time they activate the inhaler. So, to summarize, inverting the canister fills the chamber, pressing down activates the valve by aligning the hole, and the high vapor pressure propels the medication out in a swift, controlled spray. This process is fundamental to how MDIs deliver medication reliably and effectively as part of aerosol drug therapy. Now, let's look at what happens when you use a pressurized metered dose inhaler. First, when you invert the canister, meaning nozzle down, and place it into the actuator, the suspension inside the canister fills the metering chamber. This is a key step because it ensures the correct amount of medication is prepared for delivery. Next, when you press down on the canister, it causes the metering valve to align a small hole with the metering chamber. This alignment is crucial because it allows the medication to pass through in a controlled way. Then, the high vapor pressure of the propellant forces the metered dose out through that tiny hole and through the actuator nozzle. This pressure is what pushes the drug out of the canister and into your airway. Finally, the entire process of aerosol production happens very quickly, typically in about 20 milliseconds. This rapid action ensures a fine spray, which is essential for effective inhalation and drug delivery. So, in summary, the process involves inversion to fill the chamber, valve alignment to control the dose, propellant pressure to eject the medication, and a quick production time to create the aerosol. All of these steps work together to make sure you get a precise and effective dose with each use. Now, let's take a closer look at the propellants used in pressurized metered dose inhalers. Here, we compare HFA, or hydrofluorocane, with the older CFC, chlorofluorocarbon. The key difference is that HFAs are more environmentally friendly and have become the standard in inhaler therapy. One important aspect to consider is the plume velocity, which affects how the medication is delivered. When the inhaler is actuated, the plume initially travels at about 15 meters per second. However, within just 0.1 seconds, that velocity drops to less than half, which helps improve drug deposition in the lungs and reduces oropharyngeal side effects. Understanding these differences is crucial in optimizing aerosol drug therapy and ensuring effective, safe delivery of medication. Now, moving on to breath-actuated PMDIs. These are a variation of the standard pressurized metered dose inhalers. The key difference is that they incorporate a trigger that activates during inhalation. This design aims to make the delivery of medication more synchronized with the patient's breathing. The benefit here is that it theoretically reduces the need for the patient or caregiver to coordinate the actuation of the inhaler with their inhalation. So, it simplifies the process and can improve the accuracy of medication delivery. Most PMDIs we see are what we call press and breathe devices, meaning the patient presses the canister and then inhales the medication. Standard PMDIs require this coordination, which can sometimes be challenging, especially for certain patient populations. Understanding these variations helps us choose the right device for our patients, ensuring they get the most effective treatment. Now, even after the labeled doses have been administered, the PMDI may still deliver more actuations. This phenomenon is known as the tail-off effect, and it can result in delivering little to no medication to the patient. It's important to recognize this because it can impact the effectiveness of the therapy. The good news is that the FDA has addressed this issue by requiring all new pressurized metered dose inhalers, or PMDIs, to have counter technology. This technology helps track the number of actuations left, ensuring patients and providers know exactly when the inhaler is running out. This requirement enhances patient safety and helps ensure proper medication delivery. It's a key development in inhaler technology that supports better management of aerosol drug therapy and aligns with the overall goal of optimizing treatment outcomes. Now, let's talk about pressurized metered dose inhalers, or PMDIs. The newer HFA PMDIs have notably improved performance, especially in low temperatures, compared to the older CFC versions. These advancements help address some of the issues we faced with earlier inhalers, making medication delivery more reliable. It's important to handle PMDI canisters correctly. For example, never place them under water, as this can damage the device and affect its function. Proper handling is vital to ensure the inhaler performs as intended. Another point to remember is the importance of keeping the nozzle or actuator orifice clean. Debris buildup here can block the spray, reducing the dose delivered. Always keep the cap on when you're not using the inhaler to prevent dust and debris from accumulating. Temperature can also impact how these inhalers work. Specifically, low temperatures below 10 degrees Celsius can decrease the output of CFC PMDIs. Fortunately, with the newer HFA inhalers, this problem is less significant, making them more dependable in different environmental conditions. All these factors highlight how proper use and handling are essential for optimal therapy outcomes. Now, let's talk about priming and the timing of actuation intervals, which are really critical for effective aerosol drug therapy. These factors directly influence how well the drug is delivered to the lungs. Manufacturers typically recommend waiting between 30 to 60 seconds between actuations. This pause helps ensure each puff delivers the proper dose. It's important to note that actuating multiple puffs very rapidly during a single breath can actually reduce the amount of drug you inhale per puff. So, taking a little time between puffs helps improve drug delivery efficiency. Now, about priming. When you first get a new PMDI, or if it hasn't been used in a while, shaking the device and releasing one or more sprays into the air is essential. This process helps mix the drug and propellant thoroughly, ensuring you get an accurate and effective dose each time. So, in essence, proper priming and mindful timing between puffs are key to maximizing the effectiveness of your inhaler therapy. Let's talk about pressurized metered dose inhalers, or PMDIs, as part of aerosol drug therapy. The key point here is that successful administration is highly technique dependent. In fact, 2/3 of patients and healthcare professionals don't perform the procedure properly, which can significantly affect treatment outcomes. That's why proper technique for use is so important. It's not just about giving the medication, it's about doing it correctly every time. We need to emphasize that thorough education of the patient can take anywhere from 10 to 30 minutes because mastering the technique isn't always quick or easy. This education should include a demonstration and some practice, so patients can get comfortable with the steps involved. Remember, education components are crucial. Showing them how to do it and letting them try under supervision helps ensure they understand. And above all, patient education is of greatest importance. When patients understand how to use their inhalers properly, it makes a real difference in managing their condition effectively and safely. So, investing time in teaching proper technique is essential for successful aerosol drug therapy. Now let's talk about preparing your pressurized metered dose inhaler, or PMDI, for use. First, it's important to remove the cap to expose the mouthpiece. Next, you should warm the canister slightly. This helps ensure proper aerosol delivery. Then, give the inhaler a vigorous shake. This mixes the medication properly. These steps constitute the preparation phase, which is crucial for effective drug delivery. Remember, always prime your PMDI according to the manufacturer's guidelines before first use, or if it hasn't been used for a while. Priming ensures you get the full dose with each actuation. When it comes to priming and using the device, always follow the specific instructions provided by the manufacturer. Proper usage is key to ensuring the medication reaches your lungs effectively. Paying attention to these details helps maximize the benefits of aerosol drug therapy and supports overall treatment success. Now let's look at the proper technique for using a pressurized metered dose inhaler, or MDI. When positioning the mouthpiece, place it firmly in your mouth, ensuring it's between your lips, and make sure your tongue stays out of the way. This helps create a good seal and prevents medication from escaping. Next, there are two main techniques to consider. The first is the closed mouth technique, where you hold the mouthpiece in your mouth as I just described. When you're ready to inhale, actuate the inhaler at the very beginning of your inhalation and hold the device about 4 centimeters, which is roughly 2 fingers widths, in front of your open mouth. This timing is crucial to ensure the medication reaches your lungs effectively. The second technique is the open mouth method. In this case, you open your mouth wider, and the inhaler is held at the same distance, about 4 centimeters, in front of your open mouth. This technique can sometimes help deliver medication more effectively, especially for certain patients or specific medications. Remember, the key points here are positioning the mouthpiece correctly, choosing the appropriate technique, and coordinating the actuation with your inhalation to maximize medication delivery. These details are vital parts of ensuring effective aerosol drug therapy. Let's go through the steps to effectively use a pressurized metered dose inhaler, or PMDI, for aerosol drug therapy. First, it's important to breathe out normally before starting. This helps clear your lungs and prepares you for inhalation. Next, as you slowly begin to breathe in, activate the inhaler at the same time. This coordination is key to ensuring the medication reaches your lungs properly. Then, continue inhaling steadily until you reach your total lung capacity, or TLC. This means inhaling as deeply as you comfortably can to maximize the amount of medication delivered. After you've finished inhaling, hold your breath for up to 10 seconds. This pause allows the medication to settle and be absorbed in your lungs effectively. Finally, relax and breathe normally. Remember, be cautious not to spray the inhaler near your eyes, as the medication can cause irritation. If you're using steroid inhalers, it's important to rinse your mouth and spit afterward to prevent any local side effects. This post-inhalation care helps maintain your oral health and ensures the medication works as intended. Following these steps carefully will help you get the most out of your inhaler therapy. When using aerosol drug therapy, it's important to incorporate one or more valves into the device. These valves help prevent the aerosol in the chamber from being cleared out during exhalation, which means more medication stays in the chamber and is available for inhalation. Holding chambers are simple extension devices that don't have valves. They add a bit of distance between the PMDI outlet and the patient's mouth, making it easier to coordinate inhalation and medication delivery. Spacers, which are a type of PMDI accessory device, are designed to reduce oropharyngeal deposition. This means less medication ends up in the mouth and throat, increasing delivery to the lungs. Plus, spacers eliminate the need for perfect hand-breath coordination, making inhaler use easier and more effective. Overall, pressurized metered dose inhalers are a common method for delivering medication, and understanding these accessories and principles helps ensure we get the most out of each treatment. Spacers and holding chambers are special devices designed to improve how medication from inhalers is delivered. They act as a sort of extension that holds the medication momentarily, giving you more time to inhale it properly. This helps ensure that the medication actually reaches the lungs where it's needed most. These devices are especially useful for children and older adults who might find it challenging to coordinate inhaler use correctly. By using spacers or holding chambers, we can make inhaler therapy more effective and easier to manage for everyone. Let's talk about spacers and holding chambers. These devices are designed to improve how effectively medication from inhalers reaches your lungs. They help ensure the medicine is inhaled properly, which is especially important for getting the full benefit. Spacers and holding chambers are particularly useful for people who have difficulty coordinating their breathing with pressing the inhaler. You see, timing the actuation and inhalation can be tricky, and these devices make it easier. Another key benefit is that spacers can reduce side effects. How? By minimizing the amount of medication that lands in the mouth and throat, we decrease the risk of local irritation and other unwanted effects. Holding chambers often feature a one-way valve. This valve helps prevent medication from escaping during exhalation, making sure more of the medication stays in the chamber and gets to your lungs. Overall, spacers and holding chambers are simple yet powerful tools that enhance inhaler therapy, making it more effective and safer for patients. They fit into our broader goal of improving respiratory treatment and patient outcomes. Let's talk about soft mist inhalers and some key points about their use. First, you don't need to shake the device before using it, which makes the process simpler and more convenient. When it comes to ease of use, these inhalers don't require a spacer or holding chamber, so they are straightforward to operate. Additionally, they are designed to be propellant-free, meaning they operate without the need for any propellants, making them a more environmentally friendly choice. However, it's important to remember that hand-breath coordination is still necessary for effective delivery of the medication. When you press the device, the spray is released over approximately 1.1 to 1.4 seconds, giving you a smooth, controlled spray. The mechanism behind this device is quite interesting. It uses mechanical energy to convert liquid medication into an aerosol. This results in a low-velocity spray, around 10 millimeters per second, which helps ensure the medication is delivered gently and efficiently into the lungs. Overall, these features highlight how soft mist inhalers combine simplicity, effectiveness, and environmental consciousness, fitting well into a modern approach to inhaler therapy. Today, I want to talk about the Respimat, which is a type of soft mist inhaler designed for efficient drug delivery. What makes Respimat stand out is its ability to produce a slow-moving mist, and this is really important because it allows patients to inhale the medication more effectively. The slower mist reduces medication wastage and helps ensure that more of the drug reaches the lungs where it's needed most. When we think about inhaler efficiency, Respimat's design plays a key role in improving overall drug delivery, making treatments more effective and reducing the amount of medication that gets lost. This ties into our broader theme of optimizing inhaler devices to improve patient outcomes and treatment adherence. Dry powder inhalers, or DPIs, have some clear advantages, especially when it comes to ease of use. One of the key benefits is that they don't require hand-breath coordination. That means patients don't need to synchronize pressing the device with their inhalation, which can be a real challenge for some. This makes DPIs more user-friendly, especially for those who might struggle with timing. Another important point is that DPIs don't rely on propellants. Unlike metered dose inhalers, which use chemical propellants to deliver medication, DPIs rely on the patient's inhalation effort to disperse the powder. This not only simplifies the device, but also reduces concerns about environmental impact and propellant-related issues. Historically, the concept of dry powder inhalation isn't new. The Aerosol, for example, was an early DPI used back in the 1940s. It's interesting to see how these devices have evolved over time, building on early innovations to improve patient outcomes. So, understanding these principles and historical context helps us appreciate why DPIs are a significant part of aerosol drug therapy today. They offer practical advantages that can enhance adherence and effectiveness in treatment. A DPI, or dry powder inhaler, is a breath-actuated dosing system. What that means is, instead of pressing a button or inhaling through a nozzle, the patient activates the dose simply by taking a deep, forceful breath. When the patient inhales, they create the airflow necessary to aerosolize the medication. The inhaler contains a dose of finely milled drug powder, and it's designed so that your strong enough inhalation will disperse and suspend that powder in the air. This process ensures that the medication is delivered efficiently into the lungs, making DPIs an effective option for aerosol drug therapy. It's important to understand that the patient's inhalation effort is what triggers the release and dispersion of the medication, highlighting the breath-actuated nature of this device. Now, let's talk about dry powder inhalers, or DPIs. One key point to remember is that DPIs require the patient to generate a high inspiratory flow rate. This means you need to breathe in quickly and forcefully enough to properly disaggregate and disperse the drug powder into tiny, respirable particles. This is crucial because it ensures the medication reaches the deeper parts of the lungs where it can be most effective. Another important aspect is that DPIs do not need propellants, unlike some other inhalers. This makes them more environmentally friendly and simpler to use. Additionally, they don't require hand-breath coordination, which can be a challenge with traditional inhalers. You just need to inhale forcefully to get the medication delivered, making them more user-friendly for many patients. So, in summary, DPIs rely on your strong inhalation to work effectively. They eliminate the need for propellants, and they simplify the inhalation process by not requiring coordination between your hand and breath. This makes them a practical choice in many treatment scenarios. Now, let's take a look at the different types of dry powder inhalers and how they are loaded with medication. First, we have the multiple dose drug reservoir DPI. These inhalers are preloaded with a specific amount of pure drug that can provide up to 120 doses. This means you don't need to load each dose separately. You simply use the inhaler until the medication runs out. Next, there are the multiple unit dose DPIs. These typically contain a case with 4 or 8 individual blister packets of medication, which are inserted into a disc inside the inhaler. Each blister holds a single dose, making it easy to keep track of your medication and ensure proper dosing. Finally, we have the unit dose DPIs. These deliver medication from punctured gelatin capsules. Each capsule contains a single dose of drug, which you puncture just before inhalation. This method is especially useful for maintaining the integrity and freshness of each dose. Overall, understanding these different designs helps us appreciate how the inhaler type influences ease of use, dosing accuracy, and medication preservation. This knowledge is essential as we explore how these devices fit into effective aerosol drug therapy. Let's talk about how environmental factors can influence the performance of dry powder inhalers, or DPIs. One key point is that humid environments actually reduce the emitted dose of these inhalers. When there's moisture in the air, it impacts how much medication is effectively delivered to the lungs. So, humidity and moisture exposure are important considerations for ensuring optimal drug delivery. Next, the design of the DPI itself plays a significant role. Different devices have varying levels of resistance, which means how hard or easy it is to inhale through them depends on their specific design. This resistance influences how well the patient can generate the necessary inspiratory flow for effective drug delivery. Speaking of inspiratory flow, the patient's own ability to breathe in strongly and consistently is crucial. High inspiratory flow rates are often needed to properly aerosolize the powder and ensure the medication reaches the lungs effectively. If a patient can't generate enough inspiratory force, the treatment might not be as effective. Now, tying these points together, the intrinsic resistance of the device and the patient's inspiratory flow rate interact to determine overall performance. Resistance varies depending on the DPI's design, and this affects how much effort the patient needs to exert. So, understanding both the device's characteristics and the patient's breathing capacity is essential for optimal therapy. In summary, environmental conditions like humidity, the design and resistance of the inhaler, and the patient's inspiratory ability all play interconnected roles in ensuring effective drug delivery with DPIs. Being mindful of these factors helps us improve treatment outcomes and tailor inhaler choices to individual needs. Let's talk about the technique for using dry powder inhalers, or DPIs. First, it's important to remember that these devices require regular cleaning, but always follow the instructions on the product label. And a key point, never immerse the device in water, as that can damage it and affect its performance. Now, when it comes to cleaning, keeping the device clean is essential, but we need to be careful to follow specific guidelines to avoid any issues. Moving on, patients with severe airway obstruction might find it difficult to generate enough inspiratory flow for the inhaler to work effectively. This is a significant limitation because if the patient can't inhale strongly enough, the medication won't reach the lungs properly. Additionally, DPIs are not suitable for everyone. They shouldn't be used by infants, toddlers, small children, or anyone who can't follow instructions properly. These devices require a certain level of coordination and strength. That brings us to a critical point, the inspiratory flow requirement. Patients need to generate a high inspiratory flow, typically between 40 to 60 liters per minute, depending on the specific inhaler. Achieving this flow is vital for the medication to be properly inhaled and effective. So, understanding these key points helps ensure that patients use DPIs correctly and safely, maximizing their benefits in managing respiratory conditions. Let's take a closer look at some of the key principles and practices behind aerosol drug therapy. First, understanding the importance of proper technique is crucial because it directly impacts how effectively the medication reaches the lungs. Small changes in how a patient uses their inhaler or nebulizer can make a big difference in treatment outcomes. Next, we need to consider particle size, which is essential for depositing the medication in the right part of the respiratory tract. Generally, particles around 1 to 5 micrometers are ideal for reaching the lower airways, where they can do the most good. Another important point is ensuring the correct device is used for the specific medication and patient needs. Not all inhalers are the same, and choosing the right one helps maximize delivery and minimize waste or side effects. Proper patient education and technique reinforcement are also fundamental. Teaching patients how to use their devices correctly and checking their technique regularly can greatly improve therapeutic results. Finally, I want to emphasize that understanding these principles helps us optimize aerosol therapy, making sure that our patients get the most benefit from their medications while minimizing potential issues. This is a cornerstone of effective respiratory care, tying into the overall goal of improving patient outcomes. Let's take a look at some examples of dry powder inhalers. First, we have the Ellipta, which represents a modern design in dry powder inhaler technology. It's known for its ease of use and portability. Next is the HandyHaler, a widely available option that many patients find straightforward to operate. Moving on, the Discuse is another commonly used dry powder inhaler, appreciated for its reliable delivery of medication. Then there's the Discaler, which is also part of the family of dry powder inhalers, offering another effective delivery method. We also have the Twistiler, which is designed to simplify the inhalation process for users. Lastly, the FlexHaler is yet another type, known for its flexible design and ease of handling. These different devices give us a good overview of the variety available in dry powder inhaler therapy, each with unique features suited to different patient needs. Understanding these options is key in selecting the right device for optimal treatment outcomes. Now, let's take a look at the FlexHaler. This device has been used extensively in both clinical trials and in patient treatments, which really speaks to its reliability and effectiveness. The widespread usage highlights its importance in aerosol drug therapy. When we talk about the FlexHaler, we're referring to a device that many healthcare providers trust for delivering inhaled medications. Its proven track record through numerous studies and real-world applications underscores its role in managing respiratory conditions effectively. This continuity of use connects directly to our overall theme of understanding and optimizing inhaler therapy for better patient outcomes. FlexHaler is a popular inhaler device used for managing asthma and COPD. It's well regarded for its ease of use, which makes it accessible for many patients, and for its ability to deliver accurate doses consistently. When considering inhaler options, FlexHaler stands out because of these features, helping to improve treatment adherence and effectiveness. In terms of usage statistics, many patients prefer it because it simplifies the inhalation process, reducing errors and ensuring they get the right amount of medication each time. Overall, FlexHaler plays a significant role in our broader approach to aerosol drug therapy, emphasizing reliability and patient convenience. The FlexHaler is a device designed to deliver medication directly to the lungs, making it an effective tool for respiratory care. It's commonly used for conditions like asthma and COPD, where targeted delivery to the lungs is crucial for managing symptoms and improving breathing. When using the FlexHaler, proper technique ensures the medication reaches the lungs effectively. By understanding how to use this device correctly, we can optimize treatment outcomes and help patients breathe easier. This fits into the overall theme of aerosol drug therapy, emphasizing the importance of precise delivery methods for respiratory health. Let's take a closer look at the discussion on Disquse, which is a popular device used in aerosol drug therapy. As you know, the Disquse is a dry powder inhaler that delivers medication in a fine, dry form. One of the key points here is that it requires patients to have a good inhalation technique, specifically a deep and forceful inhalation to properly aerosolize the medication. This is crucial because if the inhalation isn't strong enough, the medication may not reach the lungs effectively. Another important aspect is that Disquse devices are breath-actuated, meaning they release the medication automatically when the patient inhales with sufficient force. This feature helps reduce the chance of dose errors, but it also emphasizes the importance of patient education to ensure proper use. Connecting this to our overall theme, understanding how devices like Disquse work helps us optimize drug delivery, improve patient outcomes, and minimize side effects. Proper technique and device familiarity are essential components in ensuring the medication's effectiveness, especially with dry powder inhalers like the Disquse. Let's take a closer look at the HandyHaler, which is a popular device used in aerosol drug therapy. The HandyHaler is designed to deliver medication efficiently directly to the lungs, making it a key tool in managing respiratory conditions. One of its main advantages is that it's portable and easy to use, which helps patients adhere to their treatment plans. It works by allowing the patient to inhale a capsule containing the medication, which then releases the drug as the patient inhales through the device. This method ensures that the medication reaches the lower airways effectively. Understanding how to properly use and instruct patients on devices like the HandyHaler is crucial for optimizing therapy outcomes. So, in the context of aerosol drug therapy principles, the HandyHaler exemplifies how device design can enhance drug delivery and improve patient compliance. The HandyHaler device has been used extensively by patients around the world. It's a trusted tool for managing respiratory conditions, thanks to its reliability and ease of use. When patients consistently use the HandyHaler, it helps ensure they receive the correct dose of medication, which is crucial for effective therapy. The widespread use of this device highlights its importance in the field of aerosol drug therapy. It's a great example of how proper device selection can make a real difference in patient outcomes. Overall, understanding and promoting the correct use of devices like the HandyHaler is key to optimizing respiratory treatment. Let's take a moment to talk about the HandyHaler, which is a popular device used in aerosol drug therapy. The HandyHaler is a dry powder inhaler, and it plays an important role in delivering medication effectively to the lungs. One of its key features is that it's portable and easy to use, which helps improve patient adherence to treatment. When using the HandyHaler, patients need to load the capsule containing the medication into the device, then inhale deeply and steadily to ensure the medication reaches the lower airways. This process is different from other inhalers because it relies on the patient's ability to generate a strong, consistent inhalation to disperse the powder properly. The main advantage here is that the HandyHaler provides a consistent dose, which is crucial for conditions like COPD or asthma. Plus, because it's a dry powder formulation, it doesn't require propellants, making it a more environmentally friendly option. In the context of aerosol drug therapy, understanding how to properly use devices like the HandyHaler is vital. Proper technique ensures that the medication is delivered effectively, maximizing therapeutic benefits and minimizing waste or side effects. As healthcare providers, we need to educate patients on correct usage to get the best outcomes from their inhaled medications. Now let's take a closer look at Ellipta, which is a popular inhaler device used for aerosol drug therapy. What makes Ellipta noteworthy is its design, which is focused on simplicity and ease of use, helping patients adhere to their treatment plans more effectively. It's a dry powder inhaler, so it delivers medication in a fine, dry form that patients inhale deeply into their lungs. One of the key points to remember is that proper technique is essential for ensuring the medication reaches the lower airways and provides the intended therapeutic effect. With devices like Ellipta, patients need to be instructed on how to properly load the dose, inhale steadily and deeply, and exhale away from the device to prevent moisture from affecting the powder. Throughout this presentation, we've emphasized how device design influences drug delivery efficiency, and Ellipta is a great example of how innovations aim to improve patient experience and outcomes. By understanding the principles behind devices like Ellipta, healthcare providers can better educate patients and optimize aerosol therapy in clinical practice. Let's take a moment to focus on the PodHaler, which is an example of an aerosol drug delivery device. The PodHaler is specifically designed to make inhalation therapy more convenient and effective for patients. It's a dry powder inhaler, meaning it delivers medication in a powdered form rather than a liquid aerosol. This type of device requires the patient to inhale strongly to disperse the medication properly. One of the key advantages of the PodHaler is its portability and ease of use, which can improve patient adherence to therapy. When we consider aerosol drug therapy, understanding devices like the PodHaler helps us appreciate the importance of proper technique and device selection in achieving optimal therapeutic outcomes. So, in the broader context of aerosol therapy principles, the PodHaler exemplifies how device design directly influences drug delivery efficiency and patient compliance. Now, let's take a closer look at Aerosol. This medication is an example of an inhaler used in aerosol drug therapy, specifically for conditions like COPD. What's important to understand is how these devices deliver medication efficiently to the lungs. Aerosol is designed to be user-friendly, with a built-in system that helps ensure proper inhalation technique. This highlights a key principle in aerosol therapy. The effectiveness of the treatment depends not just on the medication itself, but also on how well the patient can use the device. Throughout this presentation, we've emphasized the importance of correct inhaler technique and device selection. Aerosol is a good illustration of how modern inhalers incorporate features to improve adherence and therapeutic outcomes. So, when considering aerosol drug therapy, always keep in mind that device design, patient education, and proper technique are critical to achieving the best results. Aerosol is a medication used for the treatment of chronic obstructive pulmonary disease, or COPD. It's administered through an inhaler device, which makes it easy to deliver the medication directly to the lungs. This helps improve breathing by relaxing the muscles around the airways, making airflow smoother and easier. Understanding how this medication works is key to managing COPD effectively. Proper usage and adherence to prescribed inhaler techniques are essential for achieving the best results. This slide highlights the importance of Tudorzappressor in our overall approach to inhaler therapy, emphasizing its role in helping patients breathe more comfortably and maintain better quality of life. Now, let's talk about how you can tell when a dry powder inhaler is empty. First, it's important to ensure that all components of the DPI are correctly assembled before use. This helps ensure proper function and medication delivery. Next, when loading the dose, keep the device upright. Maintaining this position helps the device work as intended and ensures you get the correct dose. Before inhaling the medication, exhale slowly to the functional residual capacity. This prepares your lungs to receive the medication effectively. When you're ready to breathe in the medication, create a tight seal with your lips around the mouthpiece. This prevents air leaks and maximizes medication delivery. Finally, inhale deeply and forcefully at a rate greater than 60 liters per minute. A strong, steady inhalation ensures the medication is properly deposited in your lungs. Knowing these steps and paying attention to how much medication is left can help you determine when the DPI is empty, ensuring effective therapy every time.